So today we have a very difficult scar. We have a lovely 38-year-old female. She had an accident and she got this injury, and as you can see, the scar extends from the left forehead. It's vertical. I wish it was horizontal. Then it goes right through the eyebrow, but the eyebrow is pretty well preserved. Then you can see a wide vertical scar in the upper eyelid, and then the horizontal, and then again into the temple area. So in my mind and on the drawing board, I've gone through many different options, and it seems like the best option would be to do multiple Z plasties in here. So I'm going to break it into 3 portions, do small Z plasties to make it go along the horizontal line. Same thing for this portion as well, multiple Z plasties going all the way up to hide it. And in here, what I will do is right there is just an elliptical excision. So this part and this, I don't know if you can tell or not, is a little thicker as well. Make it thinner and make it almost like a blepharoplasty incision, so it blends in really nice. And this portion right here, I mean, this I'm not going to mess with right there because this is pretty okay. You don't want to mess around with that too much. So that I'm going to leave alone. Fantastic. So that's the plan. Let's get to work. It's going to take a long time and a whole year of lasers and this and that to get it better, but we'll give it a best shot. Okay, so now with a scar, I always draw, think again to make sure. I can change my mind at the last minute. It's just very complicated. So let me show you my thought process and what I've done, and then I'm going to show it to the patient as well. It's a team effort, not just me. So let's go down here. So you can see that this is a scar. I've broken it into 2. 3 would be too small of Z plasties, and then the tips don't survive, so 2. And you can see 1, 2. Now here it's important to realize why it was done. I'm going to draw it right now. So I'm going to show you the direction of the horizontal line that's going to form. So I'm going to just put this right. So this, if you see, this parallels the eyebrow, this one. So that parallels the eyebrow is going to make it look, more natural. So it's going to go like zigzag this pattern, but at least there's a long component which goes parallel to the eyebrow and less likely to be as noticeable to the naked eye. Same over here. So the vertical segment is very noticeable. So this is going to be in this direction. So this direction is less likely to be noticeable. So zigzag, zig. Okay. Also, this lengthens the scar, so this way it doesn't pull on the eyelid. Here I want to create a natural looking crease. And it's going to be just above her own crease, but it is going to be less noticeable with excision of some of the scar tissue. Then we come to the lateral aspect. This is really nice scar. I don't need to mess with it. Right at the end of the eyebrow, I've divided it again into multiple Z plasties. So again, one of the segments, this is the direction, this way. So if you notice, parallel to the forehead, this is the direction. The segment from here to here, that looked okay. I don't need to do anything, and also it's curved around here, difficult, so I'm skipping that part. But then I'm coming to this one, and if you notice, the angle here is 30 degrees as opposed to 60 degrees here, because here I need not this direction but almost like a little this direction to hide it much better. So right here to here, so that direction is going to be much better. So it's going to be a zigzag this way and less noticeable. Great. Let's show it to the patient, get her blessing, and then get started. So our patient decided actually that here she doesn't want a zigzag scar, and that's a valid concern because you're trading a longer scar and a zigzag, so it's a leap of faith. So she said, let's do it just bringing the edges closer, and we can do the zigzag on the side, the Z-plasty, and see how it looks. Down the road, if we feel the Z-plasty was much better, we can always come back and do a Z-plasty here. So see, that's why it's so important to talk to the patient, because trust me, they know what they want, and a lot of times they have better idea than you do as a surgeon. So don't let your ego get in the way. Just talk to the patient. Okay, so we are all done. As you can see, that's the vertical limb, and I agree with our patient. I think that might work out really well. And then you can see the Z-plasty right there, and then right there the ellipse. That's going to fall into the natural crease, and then I'm sorry, we have a lot of ointment on there, but that's like zigzag, zigzag, zigzag all the way. So very excited. We'll see the patient in a month, do the resurfax, and we'll keep you posted.